Now, I do think that this speaks volumes about the commitment to the ideals and the intentions of really community-orientated recovery. And I'm heartily impressed. I really am. So I've made a slight adjustment to the programme so that we can start to get into the discussion as soon as we can. We're going to take some feedback from the tables just now. And yes, will you signal? Right, okay. We're going to take some feedback from the tables just now. We'll collect some of the information, and then we'll head straight into the Q&A with the panel directly thereafter. So it might mean that we finish slightly early. I know, it's terrible, isn't it? I know. But I think that's just reward for all of the commitment that you've made, to be perfectly honest. Now, before I forget, it's really important for me to mention that the folks at the back of the room, the lady with the mustard top right at the back, if everybody turns around and looks, there you are, the waving person over there, yes.
Jackie
has, you'll be pleased to know, all of the tokens that you require should you have a car in the car park. Now, that is your escape route when we're finished. If I see anybody going through there, I'll be calling you out. Okay. Right, thank you very much. If we can start with the table that Liam's at just now and take some feedback on these two questions.
Okay, so this is on the basis now that the first to be last and last to be first, so table 10. So so after a voting exercise, we've come back with the following. I suppose one is that there needs to be mutual respect as opposed to suspect. And this is respect between service users and professionals, and service providers and service users. And that's a fundamental, I suppose, in this dialogue, in terms that there's an opportunity for this to happen, and that maybe people might be able to meet in another fora rather than just a clinical relationship. It might be a coffee, it might be a coffee shop, but a scenario where people can meet out of role just to build that relationship.
How you doing then? We then looked at marrying the approaches together rather than opposing them. So we'd have the medical model on one hand and the recovery model on the other hand. And instead of claiming, I belong to this model or that model, we should see a marrying of the two of them together, which I think is very, very needed. That's all.
Okay. So I'm gathering from that you're looking to try and take the best of both worlds then?
That's it.
Perfect. Okay.
Put the rest in the bin.
Well, do you know, actually, I think one of the things about recovery is it does and it should constantly evolve. We should learn all the time. My view of recovery, which is my view, I'm not suggesting this is my organisation's one, is that recovery is about learning every day. And we learn what works and what doesn't work for each of us individually. And the same thing applies to the approaches that we take in each of our areas. So thank you very much for that feedback. Okay, the next table.
Hello. I suppose in terms of the approaches presented this morning, we identified that engagement with a wide range of representative groups, so CAMS, youth, adult, older people, it's across the spectrum, and that really works, and it's how we do that. And I think this morning really showed us that it's not just doom and gloom sometimes. The use of humour can be just as powerful, so absolutely. I think there's a lot of learning in that first. And then in terms of what it would take for recovery to flourish in Ireland, we talked really, the most popular one was around a whole systems approach, so recovery training being mandatory and not just in mental health services but in other services as well, so that it gets across the spectrum.
Thank you very much. I think just on that latter point, I don't know if I've mentioned it before actually, but one of the initiatives which we took just on that idea of the whole systems approach, what we'd forgotten about was the policymakers in our Ministry of Health and how important it was that they understood what mental health meant. And they often get isolated. They also get fingers pointed at them. You said this was going to happen, it didn't. And part of that was about not recognising the implications of some policy actions. So one of the things that we did was to begin to do mental health training, a group of trainings called Right to Recovery, with the civil servants to help them explore their own experiences of distress. That has changed the conversation. This is early days, but it's changed the conversation. So it's not just about those who are involved in services on either side. It is absolutely about a whole systems approach, but we sometimes forget about the policymakers. Thank you. Next table.
At this table, one of the models, it was from the Moray Wellbeing Hub, that the social contact model was something that this group was very interested in and kind of like to know more about. Also, emancipation and freedom through education. And somebody said, I better say, emancipate yourself from mental slavery by Bob Marley.
It's always an indicator of the energy in the room, and people can swing at this time in the afternoon. What can I say?
I might. Well, also as regards education and how that emancipates us, and also for the professionals as well, to have that kind of open dialogue, you know, and that takes a lot of education and rethinking ways of acting. Just listened to the Recovery College in Belfast and the large community that they have and that they have grown. You know, that was a big kind of awakener, really, that something could grow to that extent. Something to putting the stamp and taking ownership of our own mental health. And somebody questioned seed funding, and was very interested in that and if it's available for other colleges. The next one was for a recovery college to flourish in Ireland. We need to lead by example and well-being, and again taking charge and responsibility of our own mental health, building community one step at a time and growing organically and in the hope of, and I have to say this too, if you build them, they will come.
Okay. Okay.
I think another way that Recovery College can flourish is by holding on to our own autonomy and integrating, you know, each college by their own core principles. So, and to have a common language as well. So.
Okay. Thank you very much.
Thank you.
I think the point about community is actually probably well expressed. One of the things that I think is important about this community is recognising that we have today created one. So there are connections that probably, I mean, some of them would have existed before we all came into this room, but they've become much more apparent now, I suspect, certainly from as an outsider coming in here. And the way we look at it, or we're trying to look at it in Scotland, is that communities exist everywhere. They exist within workplaces. They exist temporarily in places like this. Now, if you want to make something happen from this conversation today, remember this is still a community that can continue to exist beyond today. And that's what your building blocks are. It's this group of people in here. Because there is a relative unanimity of purpose here. Now, we haven't gone through all of the tables as yet, but there is a consistent message, a thread that's uniting all of the tables as you're speaking. And that was the same in this morning. So there's not disunity, there is unity. There is a community here. And it's important to recognise. Next table.
That's us. Well, we just thought that everything that was said this morning was very good. And but we did think that every different areas was at different levels in regards to recovery. So we decided then to focus on the second part and how we could make things just a little bit better and what we heard this morning into a reality. So we thought that we needed much more of a community buy-in. We are in the community, but are we of the community? What we think we need is a governance structure, community inclusive, of the primary care, mental health, education, GAA, and all other bodies that we can gather up. Some of us said we need a roadmap, but the younger ones at the table said sat-nav for primary education, for recovery education that is integrated into a community plan. And what we think is needed is somebody to lead this, to be a designated resource as part of our roadmap, SatNav. We need to have a marketing strategy and identify champions in different areas of primary care, GAA, sports partnerships. And we are talking of not creating something new, but working with what is already there.
Fantastic. I think the resources that already exist are things that you build on, absolutely. And sometimes we forget what we've already done, and we think it must be the new shiny thing that we do next. And that new shiny thing often costs quite a lot of money. And then you get the new shiny thing and you think, well, it doesn't fit into the hole that we've got in our resources. I sometimes even lose myself in the pictures that I draw. I'll be honest with you, but I think that's the reality. There's a lovely paper which was written in the 1980s. It was actually in a defence review about the life cycle of a silver bullet. So a silver bullet was for using against werewolves. Right, I really am going down a dark alley here. But the important thing about that particular paper was that something that worked in a particular context, we can see it and think, that looks great, we need it here, but we are not in that context. And we forget that that context is important. So some of the things that you were mentioning earlier on about, we see these different things happening right across Ireland. I think probably in the past in Scotland we would have said, well, that's problematic because we can't translate it. There isn't that commonality that we can focus on. But that variability reflects local communities. And somebody was reminding me earlier on today, just this afternoon in fact, that one of the things that actually links all of these things together that is common right across, and you mentioned governance, is the values. The values have to be common. The actions can be different because they relate to the local areas. So in terms of governance structure, well, you might want to have certain things in place, but the values, if they're correct, will be replicable right across each model that you have. And I think that's probably one of the key learnings from what we talked about this morning. Thank you very much. Next group. Okay.
Okay, so for question one, yeah, most people have said a few things that we said, so I will just say that there seems to be, from the things that happened this morning, there seems to be a lot of similar initiatives that we noted, and while they're not, in every single area, in every single local, service or community or whatever, there seems to be enough happening now that maybe the next step can be taken, and that's kind of what the second question is about. So it's important to note that we have gotten somewhere, and we're not starting from scratch. And I think, yeah, from people who are outside of the services, they were able to notice that actually maybe more than people who are involved locally. And then for the second question, we said that in order for recovery to flourish, and what do we need? We said we need true equality, so it can't be any more of this tokenism or just finding people and having people stand in just because they happen to have the label of service user or family member or clinician or whatever, that it actually really needs to be meaningful equality, and that lived experience is truly valued. So again, that you're not just involved in stuff just because you happen to be a certain person at a certain place in time, but that everybody's lives are actually experienced and valued for that experienced, and then that people really need to feel ownership, so that everyone, whether it's frontline staff, whether it's service users, whether it's members of the community, everybody needs to feel ownership over the process. We need to feel connected to it. We need to have opportunities to be involved in it. We need acceptance, and it has to be, I suppose, opened out. It has to be accessible. It has to be flexible. It just has to be there for everybody to take part in, and that there are expectations attached to it. So I suppose moving from, not an expectation that I may, be maintained somewhere, but an expectation that actually I am going to recover. There is such thing as recovery, and that can be for any of us. It can be for people working in services. It can be for a person attending a service, for somebody who just happens to, living in the community, wherever. It doesn't matter. There actually has to be that meaningful expectation of that things can be different and I can have a meaningful life, whatever that may mean.
I think we kind of encapsulate it in the you live the best life that you can. So a good life. And I think I was interested in some of the words that you used there, because I think that in some of the conversations that I have out with of this sort of environment, people get confused by the word recovery and what recovered is. So by way of an example, when I was in my 20s, I was diagnosed with cancer, and by the time I was 25, I had recovered, fully recovered. That's fine. But around about that sort of time, I also got a diagnosis of anxiety and depression. I am recovering. That's happening every day. I don't have to learn anything else about cancer, thankfully. But in terms of living with anxiety and depression, I learn every day because I encounter different things. Now, you might think the guy that's standing up here in front of a big audience really cannot have anxiety. That's not true. I focus on what it is, the achievement at the end of talking to you guys, for instance, and the purpose and how I think about things is really important. That's my recovery mechanism. So I'm living the best life that I can. I'm not going to return to the life that I had before any of these things happened. Actually, I don't want to. I think where I'm at the moment is okay. And I think that is what recovery is. I'm okay. And everybody else here is okay. Thank you. Next group.
Okay, so we spoke about the recovery champions again, and we said to make sure that these people are valued and that the value that they bring as people, as individuals, as humans, whatever role or hat that they might have had on, that the value that they bring, that we resource it, that we fund training, that we provide line management, that we provide time for reflective support and that as well. And then the last point is to make sure that the values of recovery are felt by everybody, whether it's within the recovery college or whether it's in the involvement centre or wherever it is that you experience your recovery education, that the warmth is felt within the venue, that the welcome is provided, that we spoke about earlier, that first person who picks up the phone to you or as you come in the door or whatever it might be, and you know, the tea and the coffee. It might sound small and trivial, but it is very important that you feel that there's a value put on you being there and that you are felt, that you do feel welcomed.
Thank you very much. I think a couple of things that you mentioned, and you've actually taken me back to what somebody mentioned earlier on as well. Reflective practice, particularly for certain clinical staff, when things are going at 100 miles an hour, we don't get the time to do that. Social workers don't get the time to do it. Actually, that's probably the most important thing in terms of professional practice. And it's the same for anybody else, getting the opportunity to think about, how did that go today and how do I feel now? That's the centering. It should be available to all of us. And I think in terms of professional practice, it does help recite those values that we've talked about today in terms of recovery, and that is fantastic. The other thing you mentioned about coffee and the environment and that sort of welcoming sort of focus, one of the presenters at the Glasgow event was Life Rooms from Mercycare, and they have designed they don't actually call it a recovery college, it's a community centre. They've taken over our Carnegie library, so it's a library, and it now exists also as a library. And it says nothing about recovery on the top. It doesn't say anything about the health service on top, actually, when you go into it. It's a community centre, but it happens to have a recovery college attached to it. It happens to have one of the best coffee shops I've ever seen in my life and the nicest coffee I've ever tasted. And it's people who, from the local community, who participate in it are trained to be baristas. There are also terminals which children and secondary school pupils come in to do their homework. It's a community centre. So there's nothing about, this is a mental health resource. You don't go there unless you've got a mental health problem about it. So it's fully integrated. That model is fantastic. I wish we had things like that in Scotland. And I think there are opportunities here to do exactly that. They managed to take advantage of the mass closure of libraries right across England to do that. So they saw that as an opportunity. And I think sometimes when we're losing resources like that, it's an opportunity. And we can look forward to doing something like that here. Thank you. Next table. Okay.
So we were kind of thinking about, I guess the question came up about who's responsible in terms of kind of getting the message of recovery education out there. And we kind of thought, like we're speaking very locally a lot of the time today, and we're thinking more on kind of a national level and kind of who do we engage, and you talked about policymakers, and that we need to be getting them to kind of have those conversations. Like the likes of Jim Daly should be out there talking about recovery education. Like it should become part of a wider discourse, not just obviously the people who's kind of preached to the converted in a way, and kind of broaden that out a little bit. We also spoke about the idea of recovery champions, but we talked about staff and kind of having the time to look into the likes of the Recovery College, if you're working with clients, to direct them there, and kind of the difficulties on your time to try and look at all these initiatives and what are they so that you're well informed. And we talked about maybe having a specific staff member that is on the team that kind of is given, you know, the right kind of time that they can just be the champion for that, like a go-to person, I suppose, within the team. And then the final piece we kind of talked about was, I guess, the most marginalised in our society. So in a way, to go along to the Recovery College in Dublin, you need to have a certain level of capacity to be able to kind of go there. And we kind of spoke, we gave the example of people who might be homeless, or, you know, their lives might be a little bit chaotic, and how to reach those people in terms of recovery education. And we spoke about maybe like an assertive engagement type model, going into homeless kind of hostels, or I think it's really important that those people are included in the recovery education piece, and that it's not just you need to have a particular capacity in order to engage or to receive or be a part of recovery education.
Thank you very much. That's bang on. From my perspective, there's a judgment for you. That's bang on. Everything's bang on. That's really interesting, because one of the initiatives in Glasgow, and it's not Recovery College, is a citizenship initiative by Turning Point Scotland, who primarily work with individuals who are homeless or with addiction problems, often with both. And that citizenship initiative is recovery-based. You can see it running all the way through it. And it's about how you re-engage and you encounter people in your daily life and you create a community. And it is people who are living on the streets, who are living in hostels. And the transformation in people's lives has been quite dramatic for anything up to 75% of the people who participate in the programme. And it's interesting when we talk about things like, people who's been hard to reach. It's often that we haven't found the right way to connect. And I think you're going in that direction. So I think there might be some benefit in us connecting those ideas that you're bringing up today with the Turning Point Scotland initiative, and I'm sure they'd be more than happy to share that with colleagues here in Ireland, because it has been so effective and so transformative. So yes, there are models out there that do exactly what you described, and if we'd had enough money, we'd have brought them with us. But thank you very much. Next.
Ladies and gentlemen, here are the votes from the jury of Table 1. 10 points for what we've said here is needs to be outside the mental health service, that there's the importance of it being connected with the community, and that recovery comes through the community network. So I suppose that has been said by other tables. And 12 points goes to the concept that mental health is itself an opportunity to build and reclaim community, because we did talk a little bit about how, you know, there's been a lot of talk about the importance of community and services being based in the community, and how important that is to recovery. And we just touched on that there's a crisis in community, and even the fact that many people don't. And many people across the board in mental health services and elsewhere live in very isolated and disconnected lives. So I think you touched about it a little earlier in some of what you said in response to some of the other points. So that idea that mental health is something that everybody in this room and everyone in every room has something to say about and has something to contribute, and that's why it could be the point that brings us all together and connects us. Okay. Thank you.
Thank you very much. I can't add any more to that, actually. Thank you very much. Next group.
Hi. With regard to the questions, I suppose we did get a bit distracted. We did focus on them for a while, and then we got into quite heated discussions. For the first question, I suppose Mike here said, you know, in any good kind of recovery education piece, you'll find the answer is in the room. And we're saying that here, you know, the answer is in the room. And what we heard was, I suppose you might say, reassuringly familiar. With regard to the things that got the most dots here, they probably aren't that as connected to, you know, the second recovery education flourishing in Ireland, but sure, I'll say what we put down anyhow. We talked a lot about getting to a stage where mental health professionals are free to express their own mental health challenges without feeling stigmatized, and that we sort of discussed the fact that maybe there's a bit of a double standard in our services at the moment, in that I suppose as mental health professionals, we consider ourselves to be expert maybe at holding distress, but then shocked when something leaks out from a colleague in terms of, and actually this same debate came up at lunchtime for one or two of us, I think. So that may be something that we need to attend to a bit more, and actually we might get an awful lot of value out of that, added value. So that was one point. I don't know, does anybody want to add anything from? Yeah. And the second point that we voted on was, I'm not sure if somebody else might be better able to express it, but it was around the need to acknowledge individuals' recovery journeys and to guard against the danger of becoming almost inadvertently judgmental about what is recovery and what is a valid recovery journey, and is your recovery journey good enough? You know, so that keep it very subjective and simple, and if it's good enough, if it's tiny, or if it even appears tiny, that could be good enough. Is that what you were trying to say? Somewhat. Yeah, yeah. So they were our two voted upon points.
Thank you very much.
Thank
you. No, is it the last group? We've got to the last group now? Yep, okay.
So, in considering the first question, we did kind of, we found the presentations very interesting, very commendable, and we noticed what we had kind of seen as a challenge, and what we noticed within our own group was the fragmentation of the different and the various stages that we are in developing our services. And whilst we noticed the fragmentation again, and we thought it was a good thing, we then kind of decided that perhaps it wasn't that good a thing, in that we felt it lacked structure a little bit. And so in response to the second question, we didn't really have two things that we voted upon because our conversation descended into a little bit of chaos, but we felt a strong need for a kind of a framework. Now, when we say a framework, we felt it from the outset to acknowledge that to still allow for the diversity in response to the needs of the community and the needs that we identify in the people that we're trying to serve, but perhaps an organisation, and I think we also kind of acknowledge not to repeat the process of 15 years of learning, but to tap into that. Yeah. And perhaps to have some kind of a framework that could support us in terms of a national network, governance, perhaps more access and more clearly defined funding sources and funding streams, and engagement between the relevant stakeholders. So, and that's pretty much where we finished on.
That's great. Thank you very much.
Thank you.
Thank you very much, everybody, for participating. It has been pointed out to me we're rapidly running out of time. I thought we had more time, but then I just realised I spent a lot of time talking at you there, so I'm going to have to stop doing that. I think in summary, though, where we're at, and I was having this conversation with my colleagues from Scotland earlier on, I think it might feel like there is a disparity in time. 15 years worth of learning is all well and good in terms of the Scottish experience, but it's the energy that you have just now to make the next step, which is important. And I think 15 years of learning, you sometimes get this peak and then a drop off of energy. You're not there. Tell you where you're at the beginnings of those peaks, and I think this is what you can grasp hold of and take it forward. So I think there is enormous learning here. I think what we will do with this information is to collate it and circulate it, and it needs to be actioned. So a couple of things I would say is you are the community that makes the changes. Each individual will add to these changes wherever they are working, and it's important you maintain contact with one another.